Good morning, guys. Thank you so much for joining. I am so sorry that we had to go off. Now we're back on. Thank you so much. We had some technical difficulties, so let's see how this is going to play out. Good morning. I'm positive it's going to work this time.
Yes.
Okay, so Ladonia, I'm just going to try to share this on your page, but if you have some security, then I might not be able to get it there, and you do. Can you just
Okay.
grab it from my personal page and put it on your page? Good
Okay.
morning, guys. Thank you so much for being here. Hello, Jeever from Malaysia. Thank you so much for being here. I am so sorry. I'm just a little bit late. We had some technical difficulties. And
Mhm.
so we're just arriving, but it is the right time. It's a wonderful day to learn from Ladonia. So hang on tight, and we're about to get this party started. There you go.
There I
Being
go.
here. Thank you. Perfect. Hello, Jeever. Thank you for joining us. Hello, Dee from Virginia. Thank you so much for being here. And I can see some more people joining, but if you're not directly on my page, I might not be able to see you. But I just want to let you know that I love you very much. And we have already spent some time trying to get this connected, so we're not going to waste time. So, welcome to the Civilized Presence, and you are in the right place. Trust me, at the right time. Now, please grab your cup of coffee and paper and pen and be ready to learn from Ladonia. She is someone who is very special to me. And we are here every Mondays and Fridays at 8 a.m. Eastern Time. I know today we came on at 8:25. That's okay. It happens. It's a special lesson, and that's why sometimes technical difficulties can happen. But we are excited to be here with you. I am right here in Virginia. What part of the world are you in? Just comment in the box below and just let us know where you're joining us from. And welcome. So, guys, we have been doing this every Mondays and Fridays at 8 a.m. Eastern Time. And this is session number 57, guys. I am so excited that we're still doing this. We started in the month of April and we've been paddling along. And I feel so pumped up today, especially because of the topic of the day. So if you've never met me before, my name is Louisa Akaiso, and I am a certified master civility trainer, a golden rule civility statesman, and a leadership expert. Now, you want to know what I do? I work confidently with leaders and professionals that place great importance in themselves and their reputation. And that's going to be you this morning because you made out time to be here, guys. So thank you. Now, I know we're a little late. I had people sending me messages, but we're here now. So do us a favor, share this on your page. Give us some likes, some love. I want to see all the wow faces because together we can spread this great message of civility to everyone. Trust me, there's so much pain and hatred in the world. No better time to have a message such as this one. So please share it on your page, your personal page, your business page, and invite your friends and families, even your neighbors or your enemies. That's okay. Welcome, Naeem. Thank you so much for being here. So the main goal of this Facebook series is really to help restore civility through meaningful and constructive conversation. And like I said, we've been doing this and really just trying to break down the concept of civility and teach you how easy, simple, but important it is for you to be civil. So you can begin with things like saying please and thank you, or good morning, or even just share a compliment, just like I'm going to do to Latoya today. And I said, Latoya, it's so good to see you. You look amazing.
Thank you, darling. Thank you. Thank you so much for having me. And sincere apologies for the technical difficulties that we had this morning. Oh my gosh. You know, when you're getting ready to do something phenomenal, something always try to distract you and get in the way. But you know what? God is all over this. So I am ready. I'm excited.
That's right.
And thank you for this topic because it's very, very important. And I'm very excited to have this conversation with you.
Thank you so much. So, guys, right away, I'm going to share with you the definition of civility before we get this started, just in case you're just stopping by for the very first time. So, I will be choosing the one from Civility Experts International, where I'm an affiliate with, and that states that civility is a conscious awareness of the impact of one's thoughts, actions, words, and intentions on others, combined with a continuous acknowledgement of one's responsibility to ease the experience of others. Example through restraint, kindness, non judgment, respect, and courtesy, and a consistent effort to adopt and exhibit civil behavior as a non negotiable point of one's character. Yes, that's like the moment of truth, isn't it? And you're just like,
Hmm.
oh my goodness, Louisa, I didn't know this civility is it's so much for me to do. But guys, it might seem like a mouthful, but I want you to take something away from this session is that civility is focused on positive people's treatment, being responsible to ease the experience of the person next to you. If you can take that home, that's going to make me happy. Okay, so I know the next question in your mind is who is this beautiful lady on the screen? Yes, she is our guest for today. Her name is Ladonia Yvette. And let me tell you a little bit about Ladonia. She is a woman with a vision. And she is, hello, Audrey. Thank you so much for joining us. She is an administrative assistant over facilities operations and culinary with a background in medical transcription. She is also the founder and CEO of I Win Global Incorporated, an inspirational movement to living an inspired life. She is an author, creator of Butterfly Beauty Blog, and motivational speaker, contributing writer for Me CEO magazine and Your Voice of Inspiration. She is the 2018 Embodiment Awards recipient of Empath Holdings Incorporated Honoring Humanity Forum. So, guys, um, there's something that is so important and I love so much about Ladonia is her strong passion to do a lot of work with the women around the world using the concept of the golden rule, civility, and of course, her faith. And I thought that was just great. So now, her message that she stands by is change your mindset, change your life. So can you imagine? That's why I told you she's the right person for you to be learning from this morning. So you got a chance to change your mindset and change your life. Just in case you haven't. Hello, Audrey. Thank you so much for joining us. Hello, Esther. Thank you so much for joining us. Hello, John. Thank you for being here. Hello, Charles. Thank you. Hello, Sylvia. Thank you so much for being here. Hello, EV from Canada. Thank you so much for being here. Guys, I love you very much, but I have to get back to the deal of the day because we have already spent so much time. But I'll come back to you. So, Lajonia, how this works really is just begin with questions and start up the conversation. And if we
Hmm.
do have a question from the audience, and guys, if you have anyone in the health sector, health professional, or if you've suffered any form of incivility, maybe when you went to the hospital and all that, that's what we're going to be talking about right now. So invite all of them over, put it on your page, okay? Invite them, wake them up, and let's just do this together and learn together. So, Ladonia, my big question for you today, or the very first question would be, what does civility mean to you? Over to you, Ladonia.
Thank you, Louisa. Thank you. Thank you, audience. Thank you so much for tuning in. I really appreciate your time for tuning in. This has been quite a morning, but we are blessed to have this morning. So thank you so much for being on. Civility to me, Louisa, is very near and dear to my heart. It is a humbling of yourself through any situation or circumstance when it comes to people, human beings. We're all human, but we do have a level of responsibility towards kindness towards each other. So it's very important to be graceful with your expression because it is a graceful expression of who you are truly. And it becomes a part of you, is pretty much what you represent. It's character, so how you interact with one another, how do you have a dialogue with one another, how do you inspire one another, those conversations are very important. So civility takes a big part in that, and it's not really hard to be civil, but sometimes people really just don't get it, or they don't think first. And that's when I promote, if you change your mind, you literally can change your life. It is a mindset thing. It is a receiving of the information. It is receiving of being inspired and being motivated, and pretty much just doing the right thing for the right reasons. So Civility is all of those things, and it's just being a kind and nice person, because we definitely need more of that in this world. And if each one of us would take our part and be kind to one another, imagine the world and what would it be like today.
Perfect. Thank you so much, Latonia. Being kind to one another, it's very important. Okay. If you've never been civil before, that's okay. You're in the right place. You can begin right after the session. And I just taught you what you can do. You can say please and thank you. Good morning. There's so many people around you who want you to show some kindness to them. Some of you have never said hello to your neighbor before, but you can do that today after this session. Thank you so much. So, welcome, Cecilia Hall. It's so great to have you. Please leave it in the comment box below where you're joining us from. We just want to know where you're coming from because I know that you're a VIP and I want to treat you as one. That's why I want to know where you're joining us from. Thank you. So, my next question for you would be why is civility necessary for creating and sustaining a healthy work environment? Over to you, Ladonia.
Well, I've been in healthcare field for since 1992, and as you stated, I work currently in a hospital now for the last 13 years, and I found that creating a culture of kindness is very important. Compassion as well, not only for the patients and the visitors, but most importantly for each one that we encounter, our coworkers. So it just creates a great atmosphere to work in. It literally can reduce the stress of a situation. We all go through our challenges in various departments that we work in, and those challenges vary from day to day. So you really never know what someone is really going through. So you just really have to just stay focused and be in tune of what's happening around your surroundings and just play a part, do your part. Pretty much all you can do is do your part. You really can't control the next person, but if you do your part, and normally what's seen in you will reflect into their own personality. So, what reflected off of you is like, let your light shine so bright that they cannot help but see the goodness in you and they want to be a part of that. So it can kind of change the dynamic of their workflow and whatever issues that they're having throughout their day. So it basically pretty much just starts with you.
Thank you. And Audrey, thank you so much for Virginia. Thank you. It's so good to have you here, sister. So I have another question for you, Ladonia. Now, the harm that is caused by incivility ranges from like distracting or irritable behavior to physical violence, which lowers morale. What would you consider to be one of the first steps to promoting civility amongst the healthcare staff? And what would you say triggers this behavior, this rude behavior? And what are the effects of incivility? On what kind of effects would it have on the well-being of a healthcare staff? Over to you, Ladonia.
Well, you really, it starts with the leadership as well. The leaders have a great responsibility on leading and coaching, if you will, to individuals who may be struggling with certain things. So that open door policy is very important to come in and have those conversations and those dialogues as far as how can I help you? What is going on through your day that we can get you through whatever situation you're going through? Because in every situation, especially in healthcare, it's just so much going on at one time.
Mm,
So you never know what you're going to come into. People are coming into the hospital not because they want to, it's because they're seeking help, and we are there to be whatever help that we can give them and make their life as comfortable as they can while they're there. So bad behavior is a negative contribution to that. We have to really channel in what that is and come in with the mindset when you first come into work to leave all that stuff at the door. Whatever issues that you came in with, that you're struggling with. And I'm not discounting what you're going through because everybody have, life happens to everyone. We
mm,
all have families, we all have difficulties or whatever that might be that we go through and struggle with. But it comes a time and place where you just have to contain that, and especially in a work of a place of business, we have to conduct ourselves professionally and and just interact with each other throughout the day because we're there pretty much 8 hours of the day, 8+ hours of the day. We're probably there more than we are at home, you know. So those people and your coworkers, they pretty much should become family at one point, you know, because you work in so close proximity with those folks. So you pretty much just have to figure out how you can just do the best you can and just put your issues to the side, you know, because it doesn't matter what you go through, it's how you can help the next person. And if you can help someone going through your own storm, that's a blessing in itself because after you finish helping that person, you probably will feel a little bit better about yourself after the fact too, you know, because you helped somebody even though you were struggling yourself. So it's just important to just check your drama and all that issues, you know, before you come in the place of work, and just try to make your day as best as you can.
That's correct. Thank you so much. Thank you for saying that because I do know that, there's so much data online and in the news, and people talking about really terrible treatments when they go to the doctor's office, and of course, it discourages people to go to the
Yeah.
healthcare sector or facility. And, sometimes you have people complaining, oh, I think the patient was rude to me, or I think the family of the patient was rude to me. But I always say that I haven't seen any certification that trains you or certifies you to become a good patient, but I have seen one
Hmm.
that makes you to become a good nurse. So let's just say that our patients are kind of waking up from the wrong side of the bed. And of course,
Hmm.
they are, at the time when they're ill, is not the best time for them. They can
Hmm.
be insensitive, they
Hmm.
can be rude, maybe because they're going
Hmm.
through pain. I'm not
Yeah.
excusing that, but
Hmm.
I think that is a responsibility for the healthcare practitioner, the nurse, the doctor, to just kind of try to put things under control. You don't want to give it like tit for tat. So because she's rude, you have to be rude too. And if we try to foster civility in those kind of facilities in the health space, that would make people feel a lot better and come back. So
Hmm.
thank you for explaining that. So I have another question for you. Now, researchers say that vision statements, codes of conduct, and standards of care give strong rationale and motivation to foster cultures of civility. In your view, is it important to align civility values with your organization's vision and mission? And if yes, why? You can share some examples as well. Over to you, Ladonia.
Good question. Very good question. And absolutely, absolutely, it's very important, if not the most important aspect of a company or organization, is to set those standards and those missions and visions in place, because that sets the tone of the hospital environment and the patient experience that they're going to be treated with respect as soon as they come in the door. So, funny thing is, our mission statement is making healthcare easier so
Mm,
life can be better. So imagine that statement, making healthcare easier so life can be better. So that sets the tone that as soon as you come in, we are here to treat you with the dignity and respect that you deserve. No matter how you feel, no matter how we may feel, we are here to serve you. So it's
mm,
all about customer service. It's all about servant leadership and helping the patient from the time they walk in the door, from intake to outtake, to
mhm,
make their stay as comfortable as they possibly can. I don't care if they come in the ER and you just put a Band-Aid on their bruise or whatever, you know, or if they're having a very significant surgery happen that day. It
mm,
doesn't matter the level of treatment that you get, you know, we all have to treat them all the same. Give
mm,
them that 100% VIP status, healthcare treatment that they deserve. No matter what they're going through, they're in pain. You know, they
mm,
come to you seeking help. So we are healthcare givers and we need to give the help and care that they need with compassion
mhm,
and all of that. So the behaviors the day-to-day behavior sets the tone for best practices, and that will increase our productivity throughout the day, throughout the week, throughout the month. And it just creates a safety standard for the healthcare environment, from the patients to the coworkers, and team performance as well. So it just creates for a better healthcare environment as soon as they walk in the door. So setting those missions and setting those values is highly important, because it really sets the tone of what that hospital or healthcare establishment is all about and what they represent. And we as employees really truly represent the hospital.
Thank you. And welcome, Beth Beranga from Kenya. It's so good to have you in the house. Dr. Lana, thank you so much for being here. Sandra, thank you so much for being here. Thank you, Cynthia, for being here from Canada. I appreciate you making out time to hang out with us. Now, I have another question. So, what kind of steps do you think the healthcare sector or management can take to encourage a culture of civility within the organization? What kind of steps do you think they can take? Over to you.
Well, there's many steps that they can take. It starts with them as first as well too. So leadership has a level of responsibility, and then it trickles down to everyone else. So to make the workplace better, we really have to just shift our mindset and set that tone from the get-go, because it creates an atmosphere of just genuineness and caring deeply for the patient. So we all have a level of responsibility, and so what we can do is, if it's recognition or if it's fostering employee engagement in some shape or form, when you have your staff meetings or your one-on-ones, you have those dialogue and those conversations, and to lift each other up. That's your opportunity to come collectively together before you go out into the environment where patients are, where visitors are, or where others are walking around constantly. So when you come together, um, you can get on one accord with one another and just have that rapport, and just have those question and answers, and just upbeat huddles, if you will, and rallies, if you want to, for lack of a better term, and boost each other up and lift each other up, and get us on our day. So because lifting each other up is very important. And so it's just encouraging one another. We all have to encourage one another to do the right thing. If you're having some issues or some challenges, then we have conversations about that. If you need some assistance, then, we'll have like a buddy system, and we'll just, go with each other, and just help each other out. But it's all about just creating that very healthy environment, a safety environment for the patient, because it's not really about us, it's about the patient, and giving them the best experience that they can have while they're in our care.
Thank you so much. Welcome, Doza. Welcome, Anana. Thank you so much for being here. Guys, this is a civilized presence if you're just joining us for the very first time. And the topic of today really is fostering civility in the healthcare sector. So if you do have a question, or if you've had a terrible experience before, leave it in the comment box below and I can pass it on to Ladonia. You don't want to bring the question when she's gone because I don't have experience with the healthcare sector. So, but she can still take the questions. And of course, if you stumble on this video on a replay, make sure that you comment in the box below, hashtag replay, and you can still leave your questions and I will pass it on to her. So I have another question for you, Ladonia. The second to the last question is, lack of civility in the healthcare can lead to very deadly consequences. Now, what kind of shift will we experience in the healthcare industry if we decide to embrace and foster civility? Over to you, Ladonia.
Very good question, Louisa. And I have to say this, the bottom line is this: civility saves lives. Civility saves lives, literally. So bringing the awareness of the power of civility, it really truly matters. So once we get that understanding, and know that it can reduce the stresses of everyday living and create the atmosphere of excellence in your business, including your own. And I do have to say this: if you do not have civility in your life or apply it within your daily living, then you literally are truly robbing yourself of your greatest potential.
Mm,
And that's the truth. You really have to have civility in your life in order to be a good person and live appropriately in this world, for you to set the standard for everyone else to do the right thing. So it starts with you. It's just that simple, to make life easier for everyone in the world. And it makes life easier for you as well. So civility matters. So the power of it really matters. So once we get that understanding and grasp the definition of what that really and truly means, then we will get to know the real importance of how we interact in the world, how we interact with other people in and outside of hospital walls. It doesn't matter where you are in the world, because we have contact with people on a daily basis. Once
mm,
you leave your home, you're in contact with someone, and not only that, civility within yourself, because you truly have to deal with yourself. So civility has to deal with you as well, and live and breathe within you, so you can go out and share that, and everyone can just embrace civility, and don't be ashamed of it, or quite not know what it really means, because even if they don't really know what it means, they see it in you. They don't even have to know what the name of the word is, but they see what civility represents through you. So, they say it starts with you, and be the change that you want to see in the world. So become that change. You can literally change the world. Nations can be changed. Imagine if each of us do our part with civility, what that would look like in the world and the nations abroad. Because I tell you, the healthcare field is stressful. People, come in and out, and you see so much through a daily basis. But
mm,
imagine overseas, imagine across the water what they deal with. Imagine in other nations what they deal with. If you don't have civility in your heart to deal with those patients who may be even of the poorest patients who really can't afford the treatment, I mean, what does that say about you? You have to have compassion in your heart to help people. We
mhm.
were born to help each other. We have gifts and we have talents, and we have to share of those gifts and talents to each other. So it's very important that anyone that we encounter, that we are a little bit kinder, and it's free. It costs you
Mm,
absolutely nothing,
mm.
but it's priceless. It's
That's true.
priceless.
That's
Yes.
true.
Hmm.
Thank you so much, Ladonia. That was powerful. You have to have compassion in your heart to be
Hmm.
able to help somebody else. So that
Hmm.
is so important. Even when they don't know what
Hmm.
civility is, they should see it in you. So the change
Yes.
begins with you. So my
Hmm.
final question for you, unless we have one from the audience, would be, as a health practitioner, how can I be mindful of my interpersonal skills and attitudes towards the patients or walk-in visitors, like you had mentioned? How can I be mindful of the people around me? People come in with all kinds of stressful situation, and I can imagine, especially in the ER, it can be crazy.
Hmm.
Like I mean, a lot of people are jumping in,
Hmm.
but don't forget that they're also going through pain. They're also sad. They don't, they probably had a bad day too. So how can
Yeah.
I be mindful of my interpersonal skills? Over to you, Ladonia.
Well, one thing is to be mindful is to know what the triggers are. Watch your words, your actions, your body language. All those play a part in how a person receives you. So you really have to have the proper spirit. First of all, your spirit has to be right in order to deal with difficult situations or trauma situations,
Mm,
or very grave situations. You have to have the heart and the mindset to deal with that, because you might be the first responder of someone,
mm,
so you just have to be mindful of the actions that you take, your body language, the words that you speak. Something as simple as a smile. I say that all the time. All you have to
mm.
do is smile, and it can literally change the narrative of someone's day, you
That's
know.
true. That's true.
Uh, and then, so if they encounter you first, because I tell you, I have people coming in literally from the parking lot who are lost. They
Oh,
come into the hospital maybe for the first time,
mm-hmm.
so it's very intimidating. They don't really want to be there, first of all, in the first place, but they know they come there to help and get some help. So if they encounter you, let's say, just coming out of the parking lot, give them directions,
Mm,
or
mm,
take them and escort them to someone who can
mm,
help them from
mm,
the onset. That sets
mm,
the tone. That first impression, uh, in their mind, say, okay, it's good so far from the very beginning. So their expectation is up. So
mm,
if each of us teach each other about the expectation of what the patient or the visitor is needing,
mm.
then we are able to lead better and help them from their first onset with their patient experience. So watch your words, know what those triggers are. People go through things uh, every day, all day. You just never know what someone is going through. Put your mindset and shift it to walk in someone else's shoes. Imagine what they're going through.
Okay. Okay. Great.
Walk in somebody else's shoes and imagine what they're going through. Put yourself out of the equation. And
Mm,
it's kind of like an out of body experience. Take yourself out of it because it's not about us anyway, right? So we
yes.
really have to set the tone to help other people. And if you have compassion in your heart, and civility, 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 I cannot say it enough, has to be a part of your makeup. And it actually needs to start at a younger age. It should literally be taught in school because it's like it's learned behavior. It's learned behavior. You have to teach it. Not everybody has it, so you have to have it in your possession. It has to be part of your arsenal. It has to be part of your makeup. It has to be part of you. In order for you to teach it, or if you don't even teach it, it's a part of you, so it bounces off of your spirit. Your spirit resonates with someone else. So they see it in you. So, just go out of your way to say thank you. Simple, please, and thank you. Says a lot. Just, helping someone along the way, directing them. You just have to do your part because even if you have indirect contact with the patient, what you do outside of patient relations still matter. It doesn't
Mm,
matter if you're working with or with the patient directly. What you do, whatever you do in your particular department, all that is important in the patient experience. You might not know it, they might not see it, but because you are doing your work in the hospital setting the best you can, everything that you do matters. So everything is coming together. I don't care if you're in finance, I don't care if you in the culinary, if
mm.
you the CEO, or if you in the EVS housekeeping department. Everything you do, from the cleanup, everything sets the tone for patient care and how you create the standard in that particular healthcare environment. The cleanliness, if the hospital or the healthcare environment is clean, it has to be clean. Because people come in there with all kinds of stuff. There's sickness in the hospital. People think that hospital are really clean, but people come in there with illnesses. So we really have to have a clean
That's true.
environment, a safe environment,
That's true.
and exactly, exactly. So from first impression, when people coming in from the parking lot, I mean, it sets the tone for everything. So it doesn't matter how big or how small you think your part is, it makes a huge difference in the life expectancy of someone who's seeking care, who's coming to get that treatment. So give them the A plus treatment from your body language, from your spirit, just from who you are as a person and just doing the right thing. It makes you feel good to know that you're
Mm,
helping someone.
mm.
It really should make you feel good. And if it doesn't, then shame on you. But it should literally make you feel good for helping the next person, really. So I am so passionate about it. I'm so excited to help people. It's not even funny. I cannot stand to look around and see people having a really bad day. Even though I'm not having a not so good day, I'm still smiling at everybody. I'm still, interacting with them, saying jokes and brightening their day. My day might be so not so bright, but I go out of my way to brighten someone else's day. And then all of a sudden my day is brightened,
Mm,
So you,
mm.
you just have to just, hold yourself to a level of responsibility and do your part, really.
Thank you so much, Ladonia. I have someone special in the house. I have Buki in the house, and
Hi,
she is,
Bookie.
yeah, she's one of the very few master trainers, master civility trainers, and she just joined us from London, UK. Buki, this means so
Awesome.
much to me. Thank you. Thank you so
Thank you,
much.
Bookie.
It's been such a great conversation. And I want to
Yes.
say thank you so much to Audrey for being so transparent and authentic because honestly, civility is very important that we include it in the activities in the health sector because
Yes.
healthcare sector. Because, for example, I think that the best doctors for me really are the pediatricians. You know why? Because they're always going to give you candy. They are always going to give you a candy and chocolate. And
Mhm.
so I always wish that every doctor can be like the children's doctors. Now, you
Mhm.
might not give me a candy, but can you just smile and be good to me and just kind of ask me how I am and
Exactly.
be ready to listen?
Yes.
Because sometimes when you know that you're not feeling well and you have to go to the hospital, the first
Mhm.
reaction is like,
Mhm.
oh my goodness, I don't really want to go to the hospital.
Yeah.
First off, you're going through so much pain.
Yeah.
Another thing is you have to go and tell somebody about the pain. And so if we walk into the facility and the treatment is wrong, can you imagine that you feel like you want to die?
Yeah.
So
Yeah.
please, you might not have candy, you might not have chocolates, but the candy I require from you is a smile, a
Yes.
warm smile, a warm
Mhm.
reception. And so the nurses are such wonderful people in the world. I love them so much, and I know that your work is so challenging.
Yes.
But please just stretch a little bit more, stretch a little bit
Mhm.
more, and make the patients feel comfortable. Yes, Bookie, thank you so much. Bookie says, brighten someone else's day, even though your day may not be going on as you planned. That's correct. And Bet,
Absolutely.
yeah, Bet
Absolutely.
just says, smile and ask how you are. That is true. Ask
Mhm.
me
Mhm.
how I'm doing. Ask me how it hurts. Treat
Mhm.
me like I'm a little child, like you care about me.
Yes.
Yes, James just said, I encourage my staff to show kindness to our clients at all times, especially the elderly. That's correct. Yes, James
Mhm.
has got a healthcare facility, so
Okay.
he knows how important this is. So please encourage a lot more people to just kind of share this message, guys. This is why it's so important to share it on your page. This is so important to invite people to be part of what we're doing. This message, it's so relevant for a time such as this one because if we do not take the extra step, if we do not pay attention to the person next to us, can you imagine all the crazy things that could happen in the
Yeah.
facility? So,
Mhm. Mhm.
what you should take away from this session is if you cannot give me a candy, smile to me. Be nice to me. Be nice to me.
Absolutely.
You know,
Absolutely.
I love going to the kids' doctor even more than my kids because when I remember the candy, I want to go. You know,
Yeah. See?
the kids'
Yes.
doctors are just so friendly.
Yes. Yes.
Because, for example, I am so afraid of the needles. So can you imagine if I come into your office and you're nasty again? And I'm thinking nastiness and needle, they don't go to the same.
Yes.
But, Ladonia, I want to say a big thank you to you
Thank
for
you.
making up time to be here. And I really do appreciate you. And I know that you're 3 hours behind, guys. Can
Yes.
you
It's
just
really
show
early.
some love to
Mhm.
Ladonia? Please show
Mhm.
some love and just
Mhm.
show her that you care. And I want to
Okay.
say thank you. Thank you for the passion that you have to work with women and the great work that you're doing all over the world and just sharing the message of civility in the health space amongst the women who are broken and every
Yeah.
woman. I just love what you do. And so,
Thank
guys,
you.
if you want to learn more about Ladonia, she is on Facebook.
Yeah.
Add her on Facebook. Just type in her name, Ladonia. Add her on
Mhm.
Facebook and try to
Mhm.
have a chat with her. If you have a question, try
Mhm.
to have a chat. She is wonderful. She's amazing. Trust me.
Thank you.
She is always ready to help out. She has a strong passion for women. And I
Yes.
cannot tell you guys how much work this lady is doing. So find out for yourself. She has books, she has magazines, she appears a lot on TV and on the radio. She's doing so much all over the world. So
Mhm.
if you want to be part of what we're doing, and hello, Coco, it's so good to have you here from Virginia. Thank you. You jumped in right on time. So if you're just joining us for the very first time, please, we're going to have this video on replay. And also, I will transfer this video as well later in the day to our channel on YouTube. So follow me on YouTube. Just go and subscribe to my channel. It's Louisa Akaiso, and you will find all the great videos there that we've been sharing from April. So much great content. Yes. Thank you so much, Buki. So, guys, it's the top of the hour, and I hate to let you go,
Yes.
but I have to. Now, if you did not see my video of yesterday, we talked about a new program that was starting, the Civility Police. It's time for you to report everyone to us who is paying on civil. Anyone is being rude, send them to us. We're right here and we're ready to deal with it. Thank you, Audrey. It was so good to have you in the house. We have a lot of trainings that are coming up. And if you do have a question about this topic, about any other topic, or if you would like to come on our show to share your brilliance, that would be great. Just send me an email to Louisa at thecivilityacademy.com. So, guys, I hate to let you go, but I have to, and I'm going to be here again on Monday at 8 a.m. Eastern Time. So, it's your girl, Louisa. Bye for now and have a wonderful day. Thank you so much.